as a physician, you're used to hearing about, in drug trials, they talk about the number of patients needed to treat to save a life or to have some clinical benefit. This is kind of the radiologist analog to that framing. And you basically can ask yourself, how many scans do I need to interpret? Do I need to read as a radiologist such that I expect a benefit from the AI model? So if we look at this graph, like with the rib fracture model, what it's saying is about every 90 chest CTs, I can expect this AI rib fracture detection model to help me find a rib fracture that I might not have seen otherwise. And what that means is that's a weekly occurrence for a radiologist like myself. I'm a body radiologist. I read a lot of chest CTs, and that actually plays out pretty closely to how I've experienced these models over the last couple of years. On the flip side, look at the cervical spine fracture. So you are going to see a benefit, but it's going to take you longer to notice it. And this is just because of the disease prevalence, right? You're going to see this probably once a month instead of once a week. So again, this is a nice thing. We do show our radiologists this so they have proper expectations about, how to expect the benefit in the real world. All right. And, let's put this all together in a nice kind of real world example with the rib fracture model. So in the ER setting, we said the prevalence is highest. It's about 7%. Remember, this is where patients come in with injuries. And so rib fractures are pretty common. And not surprisingly, the positive predictive value is quite high. So it's a very accurate model in this setting. And we do see that there's a boost to detection of rib fractures, which are hard to make, right? Every radiologist knows that it can be quite easy to blow by a subtle non-displaced rib fracture. And so it's nice to have the AI on board. When we look at the inpatient setting, the prevalence does go down a little bit. And as expected, the PPV drops slightly, but it's still very high. And it turns out that, most of these scans are ordered for shortness of breath or, some other reason in the inpatient setting, not necessarily an injury. And so radiologists are not primed by the history to look for rib fractures. And so we actually see a huge boost to detection. It about doubles the number of rib fractures that our rads find with this AI model on board. Lastly, in the outpatient setting, again, the prevalence drops off a lot. We're below 1%. As expected, the PPV, does decline. It's just above a coin flip here. But look at this enhanced detection rate. So, again, on the outpatient side, these are generally, staging exams for cancer, or the patient has a persistent cough or shortness of breath. And so a lot of these patients, they never tell you that, they bumped into their dresser a couple days ago, or they had a fall in the bathroom or something like that. You never get that clinical history. And so it turns out that, we miss a lot of rib fractures on the outpatient setting, even though they're less common on a prevalence basis. And so when you put this together, what we realized is, we're willing to put up with a less accurate model in this setting in order to achieve this huge boost to detection. And so it's kind of a nice way to kind of put that whole story together.